Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Skull appearances. The first one we will be looking at is the salt and pepper appearance. Salt and pepper appearance is seen with the hyperparathyroidism. Next is the lytic lesions with the B-weld margin. So B-weld margin and the button sequestrum. So here it is nothing but the Langerhans cells histiocytosis. Then comes the lytic lesions. We have the lytic lesions, and here it is larger and it is well defined. So larger and well defined and almost the same size in elderly patients. So almost the same size in case of the elder patients. And here is a punched out and the raindrop lesions are seen. So this is nothing but it is known as a multiple myeloma. So in case of the salt and pepper hyperthyroidism, in case of the lytic lesions with B-weld margin and the button sequestrum, it is the Langerhans cell histiocytosis. In case of the lytic lesions and well defined, it is going to be multiple myeloma. Lastly, the screw cut or the hair on end appearance. This is seen in case of the hemolytic anemia. This is very important, hemolytic anemia, that is sickle cell anemia, thalassemia, as well as the G6PD deficiency. To learn and grow daily like this, please do subscribe.